why your blood pressure is always wrong in the office. And I think there's one word that is the reason as to why it's wrong, and that is, I believe a lot of times people are checking their blood pressure in the office and they're getting a number and it gets them concerned. They think they have high blood pressure, they think they have malignant high blood pressure, they think they have that blood pressure that is so high that it puts them at risk of something like a heart attack, heart failure, dementia, chronic kidney disease, when in reality, the blood pressure in the office was wrong. My name is Dr. Isang, and I use this platform to be able to discuss your heart health and prevention. In this video, I'm going to be talking about why your blood pressure is always wrong in the office. And I think there's one word that is the reason as to why it's wrong, and that is time. That is time that is either our fault as an institution, as an office. Sometimes it can be the patient's fault, especially if they're coming in late or specifically on time, when in reality, we want you to come in just a little bit sooner. And the reason behind wanting you to come in sooner is that you can rest. Does this sound like you? You go into the office, you sit down, not even within 30 seconds, not even a minute, they're calling you back and they want to check your weight. Then they want to check your blood pressure. And I don't know about you, but with me, when I check my weight, I check it in my birthday suit. So imagine you're checking it in the office and it's going to be already 5 to 7 pounds more heavier than what it normally is. And then boom, right after that, they have you sit down and they have you check your blood pressure. And sometimes they have you sit down in the examination table and check it. And depending on your height, two things are going to be happening. Number one, your feet is going to be dangling off the table. And number two, your back is not going to be supported. So you're telling me that you were rushed in to get your blood pressure checked. You were weighed with your clothes on, your feet dangling. You were checked with your blood pressure with your back not well supported. And you probably have to use the bathroom. So with all of that, do you really expect your blood pressure that is checked in the office to be accurate? Less likely. That's why I trust your blood pressure more at home than in the office. Now, what is the best way to check your blood pressure? The exact opposite of everything that we just talked about. The first thing is when you come in, ideally we want you to sit down well rested for at least 5, if not 10 minutes, at least 3-4 minutes of rest. Then use the restroom. Even if you don't think you have to use the restroom, still use the restroom. Empty your bladder. A full bladder can potentially cause the blood pressure just to be a little bit more elevated than normal. Another one is when you're checking it, you want your feet to be on the ground and you want your back to be well supported. You want your arm to be at your heart's level whenever it's being checked, whether that's supported or supported. And I've seen this happen a lot of times, is that whenever they're checking, they check it with your clothes. If you're wearing long sleeve clothes, you're just putting it over that and they're going to check it. That's going to be inaccurate probably around 100% of the time. So it's very important to remove the clothing, not even pulling it up, because you're pulling it up, you're going to put more strain on your arm and you're going to get an inaccurate blood pressure reading. So that's why we have the gowns are hideous for a reason, but they're also a very lightweight and gives us the most accurate measurements possible. One of the things that I've noticed is that people will say they have, hey, I have high blood pressure, but then whenever I come to the office, my blood pressure is always elevated. It could be one of two things. Number one, they could be checking it incorrectly, or you could potentially have white coat syndrome, where your blood pressure is elevated in the office in comparison to at home. Your blood pressure is normally normal or significantly different from what you're getting in the office. In that scenario, want you to just write down what your readings are, bring it at a next office visit, but also bring your blood pressure machine so that it can get calibrated, meaning that we're going to compare your machine to our machine and make sure that we're getting similar readings at the same time, because a lot of the times it could be just a calibration issue. Ours could be reading 130s and yours can be reading 120s, and we have to ask more about how old is your machine. Typically you should be changing it every 3 to 5 years. Typically is the main word. I've had mine for about 5 years and mine has been pretty accurate, so I don't have any plans of changing it yet. There are better ones that can calibrate a lot better and send all the information to your phone, which would be pretty awesome to have, to be able to see what your blood pressures are on your phone and not just have to bring so many pieces of paper each and every time. But that's white coat hypertension when you have elevated blood pressures in the office compared to at home. Most important thing is just checking your blood pressure and understanding that there can be differences in the office and differences at home. And most important thing is that we're checking your blood pressure appropriately. We're giving you time to rest. We're giving you time to empty your bladder, and we're removing the clothing. We're putting your back well supported, and we're having your feet touch the ground. All those things need to happen to get an accurate reading, because blood pressure is the leading cause of death in the United States of America. So we want to make sure that yours is actually elevated and pseudo hypertension or falsely elevated. We don't want it to be a false positive, because I've had a lot of patients that have had white coat hypertension, and then we started them on therapies for it, and they were calling me, hey, I'm feeling very lightheaded and dizzy. My blood pressure is reading in the 80s. Your blood pressure was likely normal in the office, and we read it differently. One other thing that needs to be talked about is that if we're getting high blood pressures when you're first checking your blood pressure in the office, one hack is to just check it again, sometimes checking it 2 more times. Well, ideally, what I like to do is patients, when they first come into the hospital, they're pretty anxious, they're pretty nervous. It may be their first office visit. You just want to get to know them a little bit better, get them to talking a little bit more, figure out what's going on, and then towards the end or in the middle of the conversation, just say, hey, we're going to check your blood pressure. We're going to make sure that your blood pressure is not what it read in the beginning. And I've been very shocked that pretty much a high percentage, at least over 70 to 80% of my patients that have checked their blood pressure and it was elevated when they first came in is in the normal range. So that time is going to be the most important thing, giving them time to rest and relax, giving them time to acclimate to news, and then check it again. But more importantly is, if your blood pressure is high and then we check it and your blood pressure is still high, and it's been high in previous visits, it's been high in other visits and other people's office visits, then you likely have high blood pressure. And it's very important for us to treat that down, because elevated blood pressure is, like I said, is the leading cause of death in America. Heart disease, heart attacks, strokes, kidney disease, these can be prevented. And high blood pressure is also known as a silent killer for a reason. So you're not going to have those symptoms when you first present with high blood pressure. You don't have any symptoms unless your blood pressure is super high in the 180s, 190s. They may have headaches, vision changes, sometimes some jaw discomfort, chest pain, chest pressure, but most people don't have any symptoms, and by the time they've had a symptom, it's because they've had a heart attack. They have been diagnosed with heart failure. They're starting to become more short of breath because they've had high blood pressure for decades. I checked mine this morning before taking my medications, and it was 128 over 72. That makes me happy. So amlodipine is going to bring it down to hopefully in the 120s or 120s over 70s. But high blood pressure is extremely important. It is probably one of the 2 most important things that you can control: your blood pressure, your weight, and other dangerous risk factors such as smoking. My name is Dr. Isang. If you like this video, you're going to like this one, more about chest pain and heart disease.